Hello and welcome to Simply Sacred, a loving gaze at the inner world in a modern society. With your host, Aurora Leigh, and co-host, Kaja Gjesdal. I am so happy that we have Dr. Drew here from Peru calling in to be our special guest today. Hello, everyone.
Hello there.
Hello, my love.
If we could start with acknowledging the territory that we're on of the traditional Indigenous peoples in the land that we are on right now. And so for myself, I am on the traditional and unceded territory of Wet'suwet'en, who is the Decolonizing here in northern BC, Canada.
I'm here in the upper Amazon of Peru, which is also traditional territory of various South American Amerindian tribes. This is the territory which has been forcefully taken by the conquistadors or the Spaniards 500 or so years ago.
Yeah.
So I could possibly say that we are in a similar situation from the geographical point of view.
Yeah, the Quechuan people are in Tarapoto, Peru, right? The indigenous people.
No, there are many different. I live in the upper Amazon of Peru, in the province of San Martin. I live in a small village, which is actually surrounded by the cloud rainforest. And there are various waterfalls here. The original indigenous people here were Kumbas. That's the name given to them. But there are also some Shuars and Achuars here. But they're further into the jungle because after the village here, there is a provincial national park. And after provincial national park, there is a pure Amazon jungle all the way to Brazil and Colombia.
Okay, I'm going to introduce the podcast principles of why we show up each and every episode. The first principle is that we model and normalize conscious conversations. Principle 2 is that we provide an accepting environment to explore inner narratives without social shame, judgment, ridicule, or cancel culture ideologies. Principle 3 is that we're built on the core belief that the power of loving and connection, human connection, can restore and rewire current collective and individual trauma and social discordance. And principle 4 is that we are creating a common language around healing to empower listeners to love themselves, hold hope, and grow towards who they want to be. And of course, that is always with a lens of wellness and what wellness truly means.
I was just writing how I'd like to talk about how the three of us actually met and how I met you in that way. Dr. Drew, like, you have been an incredible guide for me. You came to me when my partner was searching for the vine of the soul because he was losing his mind. And through a mutual friend of shamanic background, you came to me and you actually flew to me and my partner, Sasha. And I had the most incredible initiation into a month of intense learning from you and guidance, and the medicines that you initially even had him taking with the mushrooms, lion's mane and cordyceps and all those. I remember when you flew in and the first place we went was Chinatown in Vancouver, and I couldn't believe how many medicines were just there in the grocery store and just the amount of knowledge you had. We had the most amazing month of learning, and I wouldn't have been able to come through. All your background was paramount in my ability to get through the trauma and understand it. And it's been almost 7 years. Oh no, it has been 7 years.
Mm-hmm.
So then I'll just go on with then Auroara. I remember just the three of us. I remember going to someone's house and it was a circle that we were in. Like we were talking last time, Auroara, about the importance of circles. And we were in the circle and you and one of the hostesses, but we're having a conversation with no one else hearing you, with no words, like language. It was through the consciousness. And at that time, I was such a baby learning. And I just was like, whoa, like you guys were laughing and talking back and forth. And the exposure to something that I really felt that shamanic work and the medicines were for my partner to heal. And that wasn't his path. But it was mine. And so I just want to honor and just how magical it is that the three of us are together after these years doing this podcast, starting it, because it's been something that when I visited you, Drew, in Peru, what was that, 2020, the beginning of 2020, when I came back, I felt so clear and really passionate about sharing all of this wisdom that you have, that Auroara has, that I have, that so many people in our group that we all know, to help the world, make love to the world. But I'm good if that's good to share. Auroara or Drew?
Yeah, I'm Dr. Andrew MacLean Pagan, and everybody calls me Dr. Drew, and I'm licensed general practitioner or family physician, as you call it in the North, as well as a psychiatrist. And I have recently moved 1.5 years from a poshest area of Lima, which is the capital of Peru, Miraflores, to the little village in the Upper Amazon of Peru, where we have a clinic here as a part of our nonprofit organization, where we are helping patients, local patients, indigenous people, as well as mestizo, the mixed blood, and as well we are attending the patients in the clinic in the nearby Upper Amazon city of Tarapoto. I'm working together with 2 of my students who are Peruvian students of Japanese and Italian ancestry, who are clinical psychologists, because I think the medicine, psychology, and psychiatry should be a unified subject. I don't think that, given the fact that I've been 35 years being a medical doctor, GP, and psychiatrist, I don't think that medicine can exist without psychology and psychiatry, or the psychology can exist without medicine and psychiatry, or psychiatry without medicine and psychology, because all of it is actually interrelated. Thus, here we practice a holistic, which implies integration of the orthodox, classical, established medicine, as well as other traditional medicines such as Ayurveda, Siddha, Unani, Tibetan, and Chinese one, as well as other traditional medical practices of the Amazon or other traditional societies across the world. So that's what is holistic, modern and traditional, integrated, but it has also a transpersonal, transcultural, and as well entheogenic or psychedelic approach when appropriate in it. Because when a person comes in the state of a disharmony, or state of dis-ease, what we call disease, it's the whole person which is affected by it. It's not just its mental, emotional state, or its kind of religious or spiritual kind of belonging, as it were, but it's also its energetic part, it's also its physical part, it's also its racial part, ethnic part, it is also its part, social part, it is also its cultural part. So all those things do play a role in one's health as well as in one's disease. And
the biopsychosocial model.
Exactly. So because it is impossible to separate one's disease from one's mental, emotional, or spiritual state, or race, or ethnicity, or social factors, or culture, as well as social and economic status. It is impossible because all this is connected. When patients come to us, every patient go through a thorough conventional orthodox medical evaluation, as well as psychological evaluation, as well as psychiatric evaluation. And then when that is done, we have a report which we give out to patients, and then the patients make the commentary on that report, and then we decide together which kind of treatment principles we are going to abide by, and what is going to be the procedure, the therapeutic procedure. And that therapeutic procedure can be prescription drugs when appropriate, it can be medicinal plants when appropriate, it can be medicinal mushrooms when appropriate, it can be also diet as a method or as a diet therapy. It can be also non-psychoactive purges, or it can be also entheogenic psychotherapy or entheogenic psychedelic psychotherapy, where we use microdose or macrodose or different natural substances, not the chemical isolates, because I can't get hold of them. And also I consider them more difficult to work with, because it has to be a clinical setting for it.
Do you use the diagnostic statistic manual lens when you're diagnosing, or do you use a different?
Yes, we are, of course. I'm using the ICD-11, which is International Classification of Disease set up by WHO. I'm not using American classification. I'm using the WHO classification for diseases.
So not the DSM?
No, because the DSM has different approaches, and those approaches I consider mostly as being over the board. There is every single thing which exists is now turned into disease. Whenever a person feels inadequate or has difficulties, immediately that person is labeled with a disease. And I think that is completely wrong, because somebody can feel or think or not in a harmonious way, but that doesn't mean that one has a disease.
Yeah.
To develop a disease takes time. So I avoid labeling the people. I had a case the other day when I had a young man who, without any doubts, is having temporary psychotic episodes because the abuse of alcohol, and then a constant use of electronics and mobile phone and internet, but he has been diagnosed immediately schizophrenia, and I disagree with that, because in order to diagnose schizophrenia, it takes time. It's not easy to do that immediately. That's why all the patients who come to see us, as well as the local patients and the patients from abroad, I just had to work with the American patient for a month. We all ask them kindly and demand from them to give us their complete life history and also medical history before we start doing the medical exam, psychological, psychiatric exam, because it's important to know one's history, where is one coming from, and it's important to know the medical, psychological history too.
And many doctors in North America don't take the time to understand that. I know that the ACE study is somewhat in the registry of doctors' scope now, but it's not in policy making for Canada's for national health standards. The understanding of trauma being the baseline for most people's struggles and stuff, that's not looked at yet, even though there's expert research coming out that proves that bipolar is rooted in trauma, that proves that BPD, by borderline personality disorder, is actually rooted in trauma and things like that. I really care about decolonizing mental health, which means not pathologizing people, but saying, hey, this person's having a normal response due to the experience that they've had or the experience that they're currently having and the context that they're in. And just like you're saying with the biopsychosocial model, is that person actually depressed, or are they responding to the fact that we're such an individualized society that isn't supporting one another with communal human connection and love? So I really appreciate the expertise that you're bringing and articulating from your psychiatric and medical doctor wisdom. And I'm really curious to hear more about your path and why you chose your path. Is there some richness in your story that you can feel prepared to offer us of your own journey?
First, I would like to say what you said is true in most of the cases, not in all. In some cases, you need to take into consideration intergenerational and transgenerational trauma too. And in some cases, you have to take in consideration the genetic or epigenetic factors. In some cases, you have to take other kind of environmental factors like industrial poisons, destruction of the environment, water pollution, air pollution, and so on. But yes, I do agree what you said. Unfortunately, many doctors, medical doctors, especially psychiatrists, the way the system works, the established system works, they have no time and they are not inclined to go into very depth looking for the potential cause of the disharmony a particular patient has. So their way of treating is actually a sick care. It's taking care of the sick people. It is not a health care. It's not promoting health. And that's the way the system works. So I know that many people, and I have a lots of friends and colleagues, especially psychiatrists across the world, and they do share a similar opinion and understanding like yourself and me here, but they don't have an opportunity to practice otherwise because the system is like that. System forces them. I spoke to somebody today, I don't want to mention where he's a psychiatrist in the States, and I told him, listen, I have this new patient and she somatizes so much that she's having such a severe migraines and severe gastritis, and she has a history of a sexual abuse in childhood. And he said to me, oh, I see this every day in the clinic, and then we just prescribe the stimulants and barbiturates to those patients, and the patients demand also the drug. And I said, this is how the system works, because system is outdated. It is not, it is completely dysfunctional, and it's completely dissociative in most cases. Yes. And the system needs to be changed because people are getting more sicker. People are becoming sicker than ever. There are more mental, emotional disorders than ever before in the history.
And the reality is, if the current medical system and the frameworks worked, we wouldn't have rising statistics. It would be working. And so it's not ludicrous or outlandish for that to be stated, is that it doesn't work. So we can't work within that model and expect change. And that's where I think that profound wisdom is around the world of people who do practice it, but it needs to be substantiated. And I think that it will end up because people will resonate with that. And I do want to articulate that when I said it was rooted in trauma, in my definition for trauma, that includes environmental toxin trauma, that includes intergenerational and epigenetic trauma. It's like, it's trauma because it creates discordance, because there's homeostasis and then there's discordance that doesn't allow homeostasis. So whatever is causing that would be a trauma, right? And so I just love the work that you're doing, but it must get frustrating at times when you, like you said, you have to work within that system.
I'm in a private practice. I work in a clinic, but I'm given a free hand. So the system does have a strong influence on people, because people think once they are diagnosed, because what is happening, once one is diagnosed with a psychiatric disorder, that is like a sentence. It's like a label put there, and the only available or the most available option for particular psychiatric disorder is prescribed medication. There is a certain kind of psychotherapy taking place, but this is still akin to a facelift. The only more real thing which is going on there, it's the biomedical approach, which has its value, but it's not everything. I'm talking that other things have to be included. And then it becomes a problem because there are many people out there who practice medicine, psychiatry, and they have never done any work on themselves. They never done any work on themselves. They have absolutely no idea what is to work on oneself. And they have no empathy, thus have no compassion, thus have no understanding, and they are very cold and reserved, and they're very rigid, and they're very strict, and they're very narrow-minded, because they have never done any work on themselves. And this is what is a huge problem, especially in the entheogenic or psychedelic field. There are many people out there which are claiming they have done work on themselves because they have been to so many ceremonies, or they've conducted many ceremonies. But that doesn't mean they have done any work, because the work implies other things. That's why, unfortunately, the shadow is so prevalent in entheogenic and psychedelic field nowadays, because people have never, not even worked with themselves. Most of the people, they've never ever worked with a shadow. That's why there is so much abuse taking place everywhere, not just here in Latin America, but everywhere, in all these lodges and all these places. There is so much abuse. Recently, I was watching some video about some place in Mexico, set up but not Mexican people, of course. And there are these people who are working with the 5-MeO-DMT. I don't know if it's isolated substance or is it the substance from toad venom itself. But the guy who was talking about was saying like how if a girl or woman comes to a ceremony, if she wears a mini skirt, then she's the one who is responsible for being abused. And I was like,
that's old victim blaming mentality that at the patriarchy has
and I was shocked by this. And this person is supposed to be expert, is the one who is serving this medicine and making statement like that. It was just unbelievable. It's, as I'm saying, there are no standards, there are no personal ethics, morals, honesty, and integrity first, not to mention any professional, ethical, or moral standards. Neither personal nor professional standards.
And then when there's not, then where's the accountability, and who has the right to hold that mirror of accountability and say, hey, you're responsible for all these people's well-being, and right now you're not being a safe person. You are not a safe guide or a safe practitioner. You are not doing it well. They'll just cast you away and continue doing what they do. I've seen it so many times.
It's very sad because of course the oneself is responsible, but at the same time, one cannot be responsible for others in the sense that one can neither abuse others. It's the whole concept about it is also a huge mistake, putting the entheogens or psychedelics on a pedestal as the panacea, all cure, and everything else doesn't really matter. This is the total lunacy, because entheogens or psychedelics are just tools, like any other tool. Of course, they are very powerful tools. There is no doubt about it. But they are just tools, and they have to be used appropriately and discriminately. And so when people talk, oh, you just go to one session of Cybin or maybe one session of magic mushrooms, and it's gonna cure your depression. It's an utter nonsense. And it's not just as anti-scientific, it's absolutely ridiculous, but it's just not the truth. And so lots of people go out there for the entheogen psychedelics, but actually they have never been well informed. They've not been well informed that all those entheogen psychedelics, they do have their limitations too. And they have their risks too. And they have side effects and adverse effects too. So that's why it is extremely important to have a life history, medical history, to have a medical evaluation, psychological evaluation, psychiatric evaluation before somebody is going into any treatment with entheogenous psychedelics. Because otherwise anything can happen. Mm-hmm. And so many things happen, unfortunately. There have been many times that people died in the ceremonies with ayahuasca because of things have not done properly. Mm-hmm. And that brings a very bad image and a very bad vibe to ayahuasca. And then those people who are very orthodox, narrow-minded, rigid, never work on themselves, stubborn and all that. And then they say, oh, listen, you look, this is what it is. This is all nonsense. It is all hocus pocus. This is the voodoo, blah, 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 blah. But this is not the case. So unfortunately, also, there is a lot of huge money in it now, and prestige, name and fame. Who is going to have a right for this? Who is going to have a right for that? It's a psychedelic, entheogen psychedelics have become just a new commodity.
How do you backpedal once it becomes that, right? And you can have authentic people like yourself saying it, but that ego drive and need to be the one pouring the medicine, they need it. They don't want to hear that. And so there has not been a regulative practices. I know when I was in Peru, what worked for me was having trusted people that I knew in the medicine world in Canada. And then it was word of mouth, because you don't go to the billboard shamans, you don't go and seek them out, you go who the trusted people are, because once you have authentic people, you can count that they know the other authentic ones. And I guess that would be my biggest tip to the listener, if they were seeking that path and felt it true in their heart, is that go to the authentic people you trust and know are authentic. And if you don't have any, don't make any decisions until you do, and then continue to ask the questions and continue to ensure, because Dr. Drew is saying things like rape happen in ceremonies because people are very vulnerable. Things like just someone does a 10-week course and all of a sudden they think they can pour medicine and hold a safe container properly for people in their deep soul journeys, and they have trauma coming up, or they don't mix medicine properly. They see it from a completely different framework than those who traditionally hold the knowledge of what that medicine truly means. And there are those people out there. And thank you, Dr. Drew, for your vantage point. And Kaja, you were going to say something at one point, and we'd love to hear from you.
Thank you. Thank you. Yeah, I've actually been taking notes because there's just been so much that has been said. Thank you so much, Drew. I think what you're just saying to Auroara, like the times right now with social media, it reminds me of what we talk about time and the amount of a team. You need a team, right? This is a village that is helping, assisting someone, right? And this is what was spoken about at the Spirit Plant Conference this year that we were at, right? Auroara, was some of the people were talking about like how you need to be collecting a team, how that can take 7 years, right? It can take a long time because, as Drew said too, like the shadow work, when you are working with people that have worked with their shadow or working with their shadow, there's going to be times where we're perfectly imperfect, right? And we're working through things and we're practicing being connected to our heart. We're practicing with our diet, our life, things like this is where, you know, what you said earlier too about when a doctor, and this is the thing, like doctor visits are 5 minutes, you know, with a medical doctor. And there's no team, you know, and then when a diagnosis comes about, which happened with my partner and Drew helped me with, when they said, you're going to die in 3 months, what that does psychologically to someone, I witnessed that. And amongst all the other things. So it's the most important thing. And this is where I feel like coming back to the initial story of you, 3 of us getting together, I felt, and I know that Drew is really passionate about this, and this is why we're doing this podcast, is because this time where social media is like everyone's shaman and everyone's healing and doing all this stuff. And it's dangerous. It's dangerous. Auroara, you and I were in a ceremony when a girl beside me I thought was going to die. It's so imperative. And this is where I know, and when Drew, you spoke about like how some of our journey here is from very past generational stuff. And that's why we have access to stuff when we ask for it, is this wisdom and this knowledge and this guidance when it comes through. Oh, I lost my train of thought because I have so many things to say. But yeah, a couple of things. I think we really need to talk really soon too about the difference between recreational use of the medicines and with using it for health purposes and in mindfulness with breath work, with yoga, with a team. It's so important. This is something I keep saying, Auroara, you said that to me. I was catching it. Again, I said it. Anyways, I'll just close with just how important I feel these conversations are. And I feel that there's going to be a lot more even just coming from this talk to be of service to others and to share whatever we have together, because it is a mental health crisis and there are people that are doing the work, and we need to have these community gatherings in any way we can. I'm still making peace with my technology abilities, but to have that technology right now is being used at such a quick rate. I actually, in my meditation this morning, was really seeing how I truly believe now, and it's been coming through for a while, but this morning in meditation, of this ability through Sarasvati energy of these kind of platforms that we can really help shift things. We really can help people and reach out to people. And I just feel so blessed. I feel so blessed today and to have these conversations. So thank you.
There was a woman here who, her husband was dying and she went to the doctor because she was just having these symptoms of sadness that are quite normal to have if your husband is dying, and maybe some of the other social contexts and abuses from her past and things like that presenting for her, and she just got given antidepressants. It's just like that. And so she asked me to work on her, and so I was working on her heart and her space. There wasn't even any space between from her heart space out, right? It was just so blocked off. Her heart was, and of course she would be feeling that way. And antidepressants are not going to treat that. Your colleague in the United States with the girl who has sexual trauma, there's real ways to move that and open it. It's very hard, which is why she wanted the prescription, right? Rather than entering into the pain of that in order to move through it. Sometimes we have to feel it to move through it, oftentimes. And do you agree with that?
The thing, first, I would like to say that each and every two-legged one, like a human, is unique and special. So everybody has a different path. So one cannot generalize anything. But of course, when one is going through sadness and grief because of a loss of somebody, that's a very delicate and it's very difficult and challenging situation, because it also brings one to one's own immortality, which doesn't exist, meaning brings to one's own mortality. There is a mixture of so many things, not just the one person, one it's dear and close to one, is also one's own self in it. And so it's a process one needs to go through and needs to be supported. In certain circumstances, maybe for particular individual, antidepressants could help, but in many cases, it wouldn't be the case. That person needs to be heard, needs to be understood, needs to be explained how the whole process is, needs to be given the tools to work on herself or himself, how to deal with the grief and the sadness. It's the whole process. We are doing this often here because recently, post-COVID, there are lots of elderly people who are dying prematurely for whatever reason that is. So we have often widows coming to us who go through this process. And to say that when somebody is going through that process, then one should be given antidepressant, it's a total lunacy. But that's what is happening, unfortunately. And because the person has no opportunity or possibility to express oneself, one's deep thoughts, emotions, and feelings, and can't open up and can't be vulnerable and can't digest, can't integrate, can't go through the process of transformation, transcendence, and finally letting go of the whole thing and just remembering one in beauty and in laughter, in smile, in joy. This process never happens in most of the people, and so on. They carry this trauma because it's a traumatic event, and their trauma carries on later in life. They have problems of different nature because they have never worked on that grief and sadness because of loss. And that part, unfortunately, is not very much recognized in the classical medicine, psychology, and psychiatry, really, because everything is pathologized. Every thought and feeling and emotion is pathologized, immediately labeled, and immediately medicated in most cases. And this is, if one, it's like I lived with my father, who was a medical doctor. He was a cardiologist and internist and gastroenterology. My grandfather was sexual transmitted disease specialist and a virology and bacteriologist. And there is one thing I have learned is also, which needs to be recognized, unfortunately, is that when somebody, for one reason or another, has this great need to be sick, that great need to be sick cannot be removed by any medication or by any surgical method, because that need to be sick is a mechanism of defense, and it's a kind of a weapon to be used in order to receive affection or benefit of different nature. That also can be the case. As I said, every person, everyone in a state of dis-ease is unique and special, so one can't generalize anything. Recent studies have shown that this idea that antidepressants work as they claimed, and the serotonin is the way how they work, has been proven to some extent that is not exactly the case, or that the case is not as strong as they have claimed. And so depression itself is not just because of different neurotransmitters being a disorder or lacking or having more of this, less of that, in this case of serotonin or GABA and so on. It is much more than that, because if you live in a family environment which is very aggressive, abusive, you're depressive, a 15 out of 10, you're gonna have the blues, but you're not gonna feel happy, are you?
You're going to be shut down, right? You're going to be reserved. Your nervous system is going to be in a freeze response. So of course you're not going to be out there and like happy. And so I know that I've come across that proven research that says serotonin levels are not the things that are malfunctioning. That is a theory that has never been quantifiably proven. And yet it is the common understanding. It is the common knowledge that has been shared that it is a imbalance of your hormones, and so you're just a flawed human. And so decolonizing mental health is a lot of unlearning that, and then when we go to relearning, that's going to be a whole new process where people will be open to those things. But I see it all the time. Even parents, they want to have their kids have their diagnosis so they can understand why their kids are so frantic and uppity and all of these things, when they're not looking at the family dynamics. They're not looking at, oh, they had high fluorescent lights from the time they're born in a screen, and red dye and blue dye, which are proven neurotoxins to the brain, and all these other things affecting the nervous system. But they're so attached to the diagnosis that you cannot say otherwise. These parents want that for their children, and that's final. And I also see it with, a lot of times it's a bit older generation than myself, but they're very committed to their medications. And like you said, they're committed to being sick. They are committed
Exactly.
to having that and wearing that on them, and that's just the way it is.
Because that gives them some kind of identity. That's what is this about. Gives them some kind of identity. And so by being sick, they are in a special, unique and special position, right? They get the affection, or they can get away with certain things, or they can receive certain things. But in the end of the day, they don't, most of the people, when they're medicated and when they're labeled, they don't do nothing in order to improve their condition.
Yeah.
And
I
that is
people solutions all the time. And even if they say, oh, I don't have the money, then I can give them beautiful free solutions. And sometimes those are ceremonies which don't cost money. Sometimes those are YouTube videos with yoga nidra where you're actually like connecting. There's so much that is out there. It is bountiful now. It is not like the previous generations that didn't access resources in the same way. That can't be an excuse anymore.
But still have the excuse.
Yes,
they
do.
Still have the excuse because they have the excuse because they see the world outside of themselves, and we must admit the world the way it is, the things the way are in the world are not very sound and sane and wholesome. So they have more excuses now than ever, actually, not to do anything. And at the same time, they have all these opportunities, possibilities, and the tools to change the status quo and the state of affairs. And most of the people are living in a limbo. They don't know where to turn as well. Of course, there always will be people who will prefer to be medicated, being labeled, and limited, and living limited and conditioned life. Okay, this is their decision. You can't force anybody anything, but you have to give the opportunity others to choose, and they say, okay, I want to choose this. I want to have the opportunity of this. I want to have opportunity of that. Not that that's why this entheogenic psychedelic field is like in Jamaica or some Mexico. Okay, you go, you pay $3.5 grand American, you stay there for 1 day, 10 days, and then you're gonna be cured. There is no medical care, there is no psychological care, there is no psychiatry care, there is nothing. That's a total lunacy. And then people go there, and many people get actually traumatized after going into the entheogenic or psychedelic ceremonies or treatments. And
I had one ceremony that traumatized me because I wasn't expecting it to flood my nervous system so much, and having my nervous system flooded like that and then not feeling safely held. The medicine was too strong, and I had a lot of freeze responses then, and my system just froze. For 4 years I took to unthaw it, and to unthaw it I had to do it methodically, but it was because of understanding what the nervous system, freeze, fawn, fight, flight patterns feel, differentiating them, being aware of them, knowing what they were is what got me through it. And how many people have things like that? Probably 80% of people have had some sort of shooken experience that is trapped in them, that either could come out in a flight response, a fight response that can be activated and gone through in a healthy feedback loop that brings them to a better place, right? There are options that people can do without plant medicine. It's just that it's scary. If you don't know what's going on in you, you think something's wrong with you, right? But we're actually mammals. We're creating a need to feel safe as life is now, right? And remembering and realizing it's as life is now. And I'm curious if you've ever had anything where you've had to heal for yourself something.
Oh, well, I have various experiences, but it's important to understand that every person, being a patient, I don't like the word client because that implies a kind of transaction, and that implies commercialization, and that implies different things. Patient is the one, it comes from a Latin word which implies the one who suffers, who is in pain. So in order for one who suffers of being in pain or uncomfortable situation, being a patient, having a disease or illness, that person has to be, as you righteously explained, has to be educated. That person has to be given tools to work on himself with a guide, in this case, with a medical doctor or psychiatrist or clinical psychologist or therapist, but the one who is definitely being properly trained, so the one can understand one situation and can understand, accept one situation, and then work towards getting out of it. So I had I had one particular situation where it was a long time ago, because I've been clinically using entheogen psychedelics in my practice for the last 35 years. I've been working on myself for the first 13 years, without starting working with others. So I remember one particular situation when I was taking ayahuasca outside of the city of Puerto Maldonado. That was 17 years ago here in Peru. And there was this indigenous Conibo shaman who served ayahuasca and gave me the ayahuasca. And then he left. And I was left on my own. And it was very difficult, because there is one thing which is very important to understand, that from the established classical orthodox point of view, all the entheogens or psychedelics, they induce hallucination. Okay? The thing is, I would not be so sure to say that this is hallucination in every single instance. It could be a false hallucination, it could be a true hallucination, or it could be something else. It could be extra or sensory kind of effect, which is not completely understood, because we don't really understand the nature of consciousness in entirety. We don't really understand how the brain and the mind works, and so on. But in that particular evening, I had this experience that I found myself in a bush of thorns all over me, and they were piercing my skin and my muscles and to the bone, and I was bleeding. I would open my eyes, I would close my eyes, I would see the same thing. I was in excruciating pain, and I said to myself, this is the moment I have to die. If it's the moment I have to die, so it's the moment I have to die. But I think I wish not to die. I wish to understand this thing. I wish to go through this pain. I will go through this pain. I will go through this suffering. I will go through this bleeding. And once I start going into becoming more and more painful, then I said to myself, I know there is something out there which is bigger than me. I know there is something there which is like what the indigenous people call the Great Spirit, or universal consciousness. And I have my own understanding and relationship with this universal consciousness. And I start praying to this universal consciousness and said, I need help. I need help to go through this. And when I start meditating and I start focusing, I start having a very clear intention. I was being attentive. I started immersing myself in it. And all of a sudden, the whole thing absolutely exploded. And this beautiful light came out. and it was so exhilarating and it was so euphoric. And I started dancing and laughing, and I was relieved, and so many things became revealed to me. It's the whole journey. And it lasted all night until the next morning. So the next morning came the shaman, and I came to him and I said, "You have given me the black ayahuasca," because indigenous people do not classify ayahuasca by the botanical names or the genus and the subspecies. They classify this by different names. There is a yellow one, or they call it the sky. There is a white one. There is a black one. There is a one which is like a thunder. There is a one is the indigenous one, and so on. And I said to him, "You giving me this black ayahuasca, and it seems like there have been so much negative and dark energy with it." And he looked at me and he said, "Doc, there is no problem for you. You're very strong. This is nothing. You can go through it." And so then I just look at him and I start laughing, and I said to myself, "Yeah, I went through this. I could do it. But how many people would be able to do so? How many people have worked on themselves? How many people have been trained? How many people would be able to go through this process?"
That's what I thought when I was going.
So what happens?
Like the last 4 years, I thought, just like, how could other people that don't have the framework of understanding have gone through it? I know someone nearby who committed suicide after he went to Peru and did ayahuasca because he couldn't he couldn't cope and adapt the realities and really figure out how to integrate and transcend through, and it's just too much confusion. And then when you're in a Western culture basis, everyone around you sees a certain way, a certain paradigm, and nobody is there to catch you and help you integrate it, and they don't have the skills themselves. I really think about that with what I went through. It brought up sexual trauma I didn't even know I had, and for me, I probably could have gone through it faster if I had a whole team up here in northern BC, but I wasn't in the Okanagan anymore. And people don't know how to support you if they're from a Western branch of medicine.
Exactly. So that's why I think there is a huge thing which is missing in entheogenic or psychedelic community when they talk about the set and setting, but they never talk about the skill. They never talk about the third factor, which is the skill which one needs to acquire in order to be able to navigate these non-ordinary states of consciousness, which can be done through yoga, meditation, mindfulness, breathing exercises, and martial arts, and so on. They are never trained, and they are neither trained or properly educated to be able to participate in this process, because one gets open up and vulnerable when one is non-ordinary states of consciousness and what they call alternate states of consciousness. But these states of consciousness that's not just one. There are many of them. They're infinite ones. And so it is very important, the one who goes into any kind of treatment, either ceremonial one or either clinical setting, that the people who go for this entheogenic psychedelic psychotherapy, they need to have the skill, they need to be educated, they need to be formed, they need to embody this being on a physical, energetic, mental, emotional, and spiritual level in a most appropriate, optimal way, so it can go through this process. Because what happens? People are neither physically fit for such a thing. People are neither energetically fit for such a thing. That's why in our overall integrated therapy here, we have a massage, we have a bone setting as well, which is similar to osteopathy or chiropractic thing. We also have a floral bath. We use the medicinal baths, which detoxify, medicinal baths, which would tonify, and the medicinal baths, which will flourish, which they call the baños de florecimiento. So it's important to work with the physical, energetic, mental, emotional, and spiritual body, as it were, as one coherent, integrate whole when one goes in the treatment entheogens psychedelics. But lots of people just go with the head. They're up there in the head, and about the body, about energy, they have no idea. It's definitely the Western approach lacks so much and needs to be supplemented without any doubt and integrated with the indigenous understanding. And that's, unfortunately, is not the case, because the indigenous people work in indigenous ways, but they don't know nothing about the brain or mind from a scientific point of view. They know nothing about that. They work on a different level. But when somebody comes from a Western world, that somebody needs to interact with that person from the scientific point of view, from the point of the mind and the brain as well, and from the point of the body, and needs to be integrated, this information. And this has never been presented.
Integrative health centers, I think, are the way of the future, but what is the push to get us there? Because there's these barriers, and I've had these goals of wanting to see that happen. I see the attempt to make it happen, but they're still based in a Western belief system, so it doesn't actually happen to the totality that it could. What is it going to take to actually get us there?
The only way how to get there is those people who are trained in established medicine, psychology, psychiatry. They have to be also trained in other methods, other traditional medical systems, and other traditional methods, and they need to come with the integrated approach. This is what I've been doing for the last 35 years. I'm constantly learning. The other day, I learned about something else from indigenous people here. And if I find that it is reasonable, there is an evidence behind it, I just then incorporate it into what I know. There is one particular thing here which is extremely interesting. It's done by indigenous people here many years ago in this particular province. They are working with one particular medicine, a medicinal plants who are using as a purge. They're using a non-psychoactive purge to detoxify and cleanse the body, the energy, and the mind and the brain of people before they go into the entheogenic psychedelic ceremonies. And I've been working with this. It is called Yavar Panga, and the scientific name is Aristolochia didima, is the family Aristocholacea. But what is happening, because this kind of genus of the plants has aristolochic acid, which is shown in the studies to be, which is toxic to the kidneys and all this. Now they think, for some reason, that this particular plant, which particularly might have some percentage of that aristolochic acid, is also toxic. But that is not the case, because many people have been using this plant, and I've been using it as well, and it doesn't have any toxicity. This is where the Orthodox conventional knowledge is only fixed on one particular isolated chemical, and then bases the whole entourage effect of a medicinal plant or mushroom or lichen as being only the same as the particular isolated chemical. And that is not the case. And they are not doing the studies with the entire plant because why they are not doing the studies, because plants don't belong to anybody, because the plants can't be patented, because there is no money in it.
Yeah, I studied that in medical anthropology, and it also, Western medicine doesn't legitimize and see the spirit of the plant, which is
that's another story.
In an indigenous worldview, you're seeing it as having a spirit that already has a wisdom that knows what you need, and that when true curanderos and medicine people who are working with a plant with someone, they're working with the spirit too. And of course, Western medicine would never see that. They cannot even see it, so they don't get to experience it because they don't allow it to be true.
Because the cosmovision, the framework, the concept, the philosophy does not include that. First is the separation between psyche and the soma and the rest. They don't, the concept, the framework they use and philosophy doesn't have that aspect. So they can't, because it's like if you go to a butcher, it's going to be very difficult that you can go to a butcher and not buy meat. But there is no way that you can buy a vegetable at butchers. It doesn't sell vegetables. So the concept, the framework is very materialistic, very mechanical, very biochemical, which is also valid. But it is not the whole answer. This is where the problem is. And it is, you cannot apply that kind of understanding to indigenous people or people who come from a different culture or people who come a different race or ethnicity or different society. You cannot apply these concepts because this ideology, because it's like a very dogmatic indoctrinated kind of ideology, because it doesn't allow for anything else. It just wants this way, and it wants with this kind of ideology to resolve everything. It's impossible, because this ideology, it is incomplete. It is partial. It is many times incorrect. That's why it cannot be done until this is not changed. And the quantum physics to start with, and the holistic and transpersonal, transcultural, entheogenic, or psychedelic approach is not integrated with it, there will be no change. They're still going to tell you, that no, it can't be done. It's like I had a cancer patient many years ago here, 15 years ago, when I used to live in the poshest area of Lima and Miraflores. She came with the terminal stage of breast cancer, the patient. And I talked to the oncologist and I said to him, have you ever done a test if this particular cancer of hers is estrogen or progesterone sensitive? And he looked at me and he said, how do you know about this? You're a general practitioner and a psychiatrist. You're not an oncologist. I said, I know about these things. And they never done anything. And they never did this thing. And then she came to me. I treated her 8 months with integrated, holistic, transcultural, entheogenic, psychedelic approach. She was on different plants, on diets. She was on diet therapy. She was also on cannabis, on oil, and she went to ayahuasca ceremonies. After 8 months, we completely removed her cancer. I cauterized her cancer with medicinal plants here from the Amazon, and we went to the hospital, show all this, and this oncologist got absolutely crazy, and he was so aggressive, shouting at me and screaming, and said that this is not possible, that this is wrong, that she never had the cancer, cannot be cured, that we never cure cancer. And I said, but you are the one who diagnosed this. You are the one who did all this. Because he completely forgot the case, because he thought she probably already died. And this is what is happening when you have the people who cannot see further away than the very noses. What do you expect? They cannot accept there is another reality, and they do not understand that we have to integrate things in order to make any progress.
It's the only way to create real tangible solutions for the dis-ease on the planet. And circling back to the original question of the blocks on why can't we actually get integrative health centers, you know what the blocks are? And that's the thing, is that other ways of being and knowing, and Indigenous ways of being and knowing, and with the cosmovision of understanding that the non-visible world is also credible, that it needs to be seen as equivocal. It needs to be seen as in addition to Western medicine, and that they genuinely work together, and that it's not snubbed away, and certain things are not snubbed away, and that they are credible. And so true integrative healing will happen when egos, like the ego that you experienced with that doctor, you know, what I see in his denial, he wanted to deny a new, different paradigm than the one he clung on to. So that is how powerful the ego is. But the egos are in medical industries. You would be contending with one another rather than collaborating with one another, as it currently stands in North America. And that's the sad reality, as people continue to suffer, as people continue to be untreated at the root cause. Like so much time, so much money is spent on treating the smoke instead of treating the fire.
Yes, but the thing is, I totally agree with you. I can give you an example. I had a team of Canadian doctors a few years ago who came with me to see this particular community in Chasuta area, which is about 3 hours from here, which are Quechua speakers, the indigenous speakers, and they are descendants of Chancas, and which are the ones who fought the Incas, and then they retrieved from the highlands area of Peru into the jungle. So there is this curandero, ayahuasquero family, the father and the sons who ayahuasqueros work with ayahuasca, and the father developed, they show me all the photos, they show me all the diagnoses they had from dermatologists, infectologists, and everything. And they told me about the story that one day father started developing this exfoliative, like a pus, like a skin disease with bumps, liquid, itchy ones, burning blisters all over his hands, palms of his hands, and the soles of his feet. And he went to indigenous guy, and he went to all the specialists. There is infectious disease hospital here. Tropical disease is very well known here in Peru. Che Guevara itself, Dr. Che Guevara, trained in tropical disease here in Peru, and also the oldest psychiatric hospital in all the Americas is here in Peru to start with. Anyway, so there is the classical orthodox conventional medicine here is very rigorous, very, very thorough, very conservative and orthodox, probably the most orthodox in all the Americas. That's why lots of Peruvian doctors, they immigrated to States and Canada, worked as doctors and psychiatrists and so on, because they have this orthodox conventional program, really very tough, undergraduate one. And this elderly shaman had this thing, and he went from one doctor to another, and we checked with Canadian doctors and everything, his exams, as I said. For 1 year, they couldn't remove his condition. They didn't know what it was exactly. And either probably some unknown tropical dermatological condition. Then finally, the youngest of all the sons, who is the shaman to ayahuasquero, he said, it's enough. we need to sit together as a family and go into the ayahuasca ceremony and find out what is this all about. So they went into the ayahuasca ceremony together, the family gathering, and they told me that in the ayahuasca ceremony, the spirit, like you said, the spirit of the plants, would definitely, these things exist. The indigenous people call it the spirit, and it's a consciousness of the plant. It's, although plant does not have a nerve system, neither has a mushroom or lichen, but it has a consciousness. There is no doubt about this. Very difficult to prove it by orthodox scientific method, but it is definitely there. Yeah, I can say that from my personal experience. And also that these people talk to the spirit ayahuasca, and spirit ayahuasca said, listen, you have to go to this place across the mountain and find this particular plant. I don't know what is the plant called, but I can tell you how it looks like. And you need to bring this plant, and then you need to detoxify this plant in a particular method, and then you need to make a poultice out of it, and then you have applied the poultice and the soul and the palms of your father, and after 1 week, and you have to go on a particular diet, not salt, no sugar, no pork, and so on, because many people, no sex, because many people think, oh, you're doing this diet. This is all nonsense. It is not like that. And they did this. They did exactly what they were shown in ayahuasca ceremony. They found it took them a long time, 10, 20 days to find it. They found they applied. After 1 week, her condition completely cleared. And there were photos, how are his hands before and hands after. And I saw his hands, they're absolutely clear. And for me, that is an evidence. They said evidence-based medicine, evidence-based psychology, evidence-based psychiatry. This is an evidence. Oh, now the case is we, meaning the scientific community, including myself, we don't really understand how this works. But bloody hell, we need to learn and understand how these things work, and then we can apply this to the next one who is suffering from the same condition. And this is what people need to understand. This is not some kind of hocus pocus or some kind of fantasy or some kind of, I don't know, delusional thing.
Yeah.
Amazon is the greatest pharmacy world has ever known.
A great way.
75,000 different medicinal and plants and mushrooms. There are 75 different kinds of entheogen psychedelic mushrooms. I've been told by one of the mycologists the other day, but nobody knows anything about it because there is no study there. And so the Canadian doctor came to me. No, you have to tell them that we want to know the plants, and you have to get the plant, and then how much do they want? I said, no, this is not how the things work. First, you need to have the meeting with indigenous people, and you have to show the respect and understanding. And you have to have the cultural and the racial and the ethnic and also the spiritual sensitivity of the highest order before you can even think of asking them about this plant, because they are not going to give it to you. Yes. They're going to give it to you, so you take from them and do the biopiracy and making them patent medication and then make money and completely forget about them.
No. That Western entitlement.
Yeah, but I have worked with indigenous people for a long time in China, in India, in Africa, in all the Latin America, in North America too, in Mexico too, all Asia, and most of the places in Asia, Cambodia, Vietnam, in Australia too. And I take this approach. I come in and tell them, I'm a doctor, I'm a family psychiatrist, I work with the plants, but I'm still learning. I'm here to learn. Please teach me. I want to learn. Show me. I'm not here to steal from you. I'm here to learn. And you help me to learn things. I'm going to help you with other things. And so we come to a common ground. But when I try to get because I tried on many occasions to work with certain indigenous groups. Then it comes the organizations who are behind them and the leaders, indigenous leaders. And unfortunately, most of those indigenous leaders are very corrupt, and they want money, and they after name and fame, and they're greedy beyond words. And then the whole bloody thing collapses again. And these very people who have this amazing knowledges, how many of these indigenous people, not just in Amazon, in Africa, how many indigenous people in Canada have the knowledge? I'm sure they have the knowledge, but they're not coming out because so much, or if at all, because the way they've been treated. You know,
and
the
it's
way they've been
epigenetic
treated.
trauma, right? Like,
Of course.
and it's held within most people, most races of people. That epigenetic trauma of, Kaja talks about witch burning a lot of times. Epigenetic trauma for Indigenous people in North America would be, we couldn't even sing. We couldn't even have a drum. We couldn't even dance. And you want me to feel safe too? And you want me to just share the knowledge willingly when settlers came and the women were sharing knowledge so European men could survive? And then they were betrayed so deeply? Like, that is stored on a cellular level, on a spiritual level. That is stored. It's not safe to share. And I think talking about ego and talking about what doesn't allow for the beauty to unfold of what healing could be and what healing spaces could be is paramount in us asking for and wanting authentic, genuine people choosing and making decisions. Lives are at stake. We should be seeing it as the utmost importance.
Yes, but definitely. But it's also important to understand not just the indigenous people across the world carry the epigenetic intergenerational transcultural trauma. It is also the white and Western people carry that, because they are the ones who have been indigenous ones too. Lots of white Western people cannot understand that 1,000 years or 1,000 or 500 years before the Christians came to Latin America, to all the Americas, and did this bestiality, brutality, they have done the same to the indigenous people of British Isles, to Ireland, to Scandinavia, to Germany, what is called now. They did the same thing. They did 1,000 or 500 years earlier to Scandinavians. 500 years earlier, they did the same trauma they did to indigenous people. And that's the most of the white people and Western people, they are severely traumatized, not to mention also the Jewish people who had another kind of trauma, not to mention also the African people on African descent, which have another trauma. No, there is the whole history of the humankind. It's mostly a traumatic event. And people have been traumatized to such a high degree, and they deny these things. They don't want to come to terms with the trauma they have. That's why they cannot see, feel, perceive, have empathy, compassion, understanding for trauma of other people, because they simply deny. They use this mechanism, the worst primitive mechanism of defense, which is called denial. They just deny their own trauma. And then they say, no, I don't have a trauma. I have a depression. No, I don't have a trauma. I have anxiety. No, I don't. I have been sexually abused, but it doesn't matter. What happened to me when I worked at all this psychiatry hospital in Americas, which is in Lima. It's called the Hospital Auroara. I went to a certain pavilion, as it were, and there all the women have been diagnosed with paranoid schizophrenia. And then in time, I realized all these women have been sexually abused as little girls. And when I asked the other psychiatrists about this, they said, yeah, it doesn't matter, this is irrelevant. And I was like,
exactly.
How is this possibly irrelevant? This is one of the possible causes or great thing which contributed to this condition, because
Correlated
if
evidence.
you've been sexually abused and everybody's telling you that is not true, that's a lie, you're imagining it, and you're a bad girl, you're a filthy girl, or you're a bad boy, because the boys get abused too. And so if everybody tells you that you are not, that is not true, they're imagining if this is covered up within the family or society, and then what is going to happen to you?
It happens in the community here. There's so much sexual trauma and abuse, and no one talks about it, and everyone will just call you crazy. If someone's had sexual trauma, they're acting it out, but they're not allowed to talk about it. I knew someone who got diagnosed with schizophrenia after doing plant medicine, after being like her heart came wide open. She wanted to talk about it, and the community was more interested in keeping her quiet. And she got labeled with schizophrenia, and she's still not doing well.
I'm very
it's been
sorry.
a long time, 500 years of women being called crazy for having real legitimate responses. Emotion is all natural. We have all of our taste buds. We have all of our emotions. Of course, they're all sacred. Of course, anger is sacred. Of course, sadness is sacred. Of course, grief is sacred. It's part of being a human being, and human beings are sacred, right? And so these are the things that we have to come back to remembering, and people know that. People are wise. People are so sacred and wise, and when they hear this, they go, oh yeah, generations to come to get to that point again. And when I worked with non-Indigenous, or what we call non-Indigenous here from that kind of colonial lens, when I work with people from European descent, sometimes their stuff is 13 generations back, and I can read it in their system. And that is a lot harder to even know, because the fish is in the fishbowl for so much longer and you're not aware of it. That is harder than for Indigenous people who have 5, 6 generations back to go, oh, we remember more recently how it felt prior to that colonial abuse and trauma and intensity. But Indigenous European people have been traumatized for so much longer. And I always say we're not ready to have that conversation here yet when it comes to the topic of decolonization. But I'm so glad that you brought it up.
No, but this is obvious. It's such a sad story, really, that lots of people who have been sexually abused or who have been traumatized in different way, that is never taken seriously and is never being taken into consideration when the treatment strategy is taking place. And lots of the people say, unfortunately, most of the women who come into our consultation space have also been sexually abused too. What I think is important is that I personally think the only way how we can go around it is that we set up a project with institution and research center and education where these things can be applied. And this is exactly what our project is about, where we want to integrate all these aspects and then bring other doctors and other scientists to come and study and research and then document and then bring these things to the West, because unfortunately, lots of things in the Western world not being allowed for whatever reason, or political correctness or whatever vented interest out there, which don't permit this thing to happen. But here in Peru, Ayahuasca is a national patrimony of Peru, and Huachuma, Cactus San Pedro is national patrimony of Peru, as well as other indigenous ancestral methods also protected here. Of course, it does happen a lot of abuse here as well, like in North America, because there is a lot of drug tourism here. There are lots of people coming here and they just go for ceremonies, but there is no medical or psychological or psychiatric work taking place. There is no skill, there is no integration, there is no follow-up, there is nothing going on as well. Unfortunately, this is how it is, and we are doing our best. We are only 3 people here and doing our best, and we are still learning, and because there is so much to learn, because every time somebody comes to you and it's suffering and lots of pain, and uncomfortable, and there are so many things. And as if you do not better the social, economical, cultural, educational, spiritual aspect of the being, only just with the medical, psychological, psychiatric one, you will not be able to solve the issue, whatever it is, because everything is related. So there are people who, for instance, people say, oh, but he lived in a perfect family with a perfect family dynamics and a lovely mother and lovely father, but they know nothing about the intergenerational, transgenerational trauma, which has been transformed to a womb of a mother when she was pregnant with that particular child. They don't know anything about it. And this is where I think the entheogens and psychedelics and psychedelics, because I prefer the term entheogen than psychedelic, because for various reasons, I explained that in detail on my website. But entheogens, psychedelics are one of the tools, one of the best tools when used appropriately, consciously, and in righteous, respectful manner, scientific, integrated manner. They can greatly help with removing such a enormous burden which trauma is. Like I have I very close Jewish friends, some of them are Canadians, and there is always this kind of thing that they are always in some kind of state of, some of them or many of them, they in a state of some kind of unease, or like instead of some kind of angst that something is going to happen to them, there's going to be some kind of abuse towards them, or something terrible is going to happen to them. Why? Because that comes from the unconscious, or that comes from this trauma they've been going through for so many generations. The same things happens with the people of African descent. When they go apply for some work, they think they're not going to get a position because they're of African descent. Lots of people, including the Western white people, are also traumatized, but everybody deals with it differently, and not everybody knows how to deal with it, and needs to be set up a program and a structure and education for it, so people can learn how to deal with these things. And these things have to be recognized, because otherwise these things are going to continue forever, and status quo is going to prevail. And I am against the status quo, because the status quo does not bring progress. It brings stagnation. It brings stagnation, and also turns into perversion and abuse and bestiality in the end, because the people who are in the end in power, they're actually not entitled to do the things they do, because nobody should be entitled to cause suffering and pain of others, and then cover oneself behind the political correctness of some kind of law or some kind of position or name or fame. Causing suffering and pain to others is causing suffering and pain to oneself.
And it's maddening to not be able to do anything and to feel powerless. And that's where anger comes from, is when you know it's an injustice and you feel powerless to stop it. And I've gone through that so much in my life, and my soul has wept and grieved that, okay, you wanted to dominate the world and this is what you wanted to create, really? And my soul had anger and stored anger for that for a very long time. And it's not that I don't still see that as corrupt, but it's that I've chosen to have to release it in a different way. And so that I can try to walk and do good. And I so value you for the walk that you do and the good that you do. And thank you for showing up as the light that you are, and as the medicine person that you are, making a change. And when you speak to caring, you speak to how you care for your patients. and it takes time. That's the thing, is that there's just so many people suffering and not enough people who are equipped to sit with and take care of. And that's where, when you said it yourself, when you said people need to be equipping for themselves. So even the mastery that you have, you could be sharing into the world in a bigger way that equips them. And that is possible as well. And then it's shows like this where who knows how many people will end up hearing it, but that in itself can inspire. And so there is hope. And I always do try to leave the show shifting into hope, because that there's so much potentiality and possibility of healing. And there's so much potentiality of reaching the many. And it can be hard to see it sometimes, especially when you're in the trenches. So I just want to acknowledge you and acknowledge that and acknowledge Kaja. And I want to see if Kaja wants to close with a prayer, because I think closing with a prayer would be really powerful and profound. We do have to acknowledge what isn't ideal. We have to acknowledge the issues and the problems. And to quote Dr. Gabor Mate, he says, we've researched all of the issues. We know what the issues are. We now need to just be applying our resources to the solutions. And I do see that. We do need to acknowledge, though, and know and name it and name the issue, and then say, okay, get to the point the grief cycle where we go, okay, so now what? So now what? And then our focus and our energy and our capacity can go towards the so now what stage. And so, Kaja, I hope that in your prayer, you help us end off at a really positive so now what?
Thank you. Yeah. And I'm just buzzing from all of this. And the thing that just keeps coming up for me in a prayer for all of us is that we come together in all four directions, in all five elements, in all of our highest and greatest good for self and all being. That this coming together, our ability to come with medicines and medicine people of all over, and to listen and to be present in the gifts that we all have to share, because we all are special. We all have healing and coming out of survival. We all have worthiness to thrive. And I just have so much hope for the future with circles like this, just even three of us together in circle with the highest intentions for a better world and our future for our children, that we can turn around and transform all this and transmute it into so much learning and so much healing for the future generation, and 7 generations forward and 7 back. I just am so blessed. I feel so blessed to be in this space. And I honor the integration that I feel needs to maybe happen from this. It's a lot of information, but to all 2-legged, 4-legged, winged, finned, I feel like I'm going to cry right now. So I'm just going to end with all our relations. Thank you.
I would like to thank you both for giving me opportunity to be with you again and express my innermost desire I do have, that those doctors and scientists and psychiatrists out there, they start to wake up and realize that what they know is just a little thing what needs to be known in order to help all beings, human and non-human, of all forms and shapes, in order to honestly relieve the suffering and pain they go through, because being sick, either physically or mentally, emotionally or spiritually, and not being able to live fully and appreciate this amazing gift called life, it's a real tragedy. So I hope that those doctors and psychiatrists will wake up and create this movement where we need to revolutionize the medicine, the psychology, and psychiatry for the benefit of all, and for the benefit not just ourselves, but all the beings, human and non-human, as well as this planet, because this planet needs us being different, needs us to be supportive, needs us to be kind, needs us to have a compassion, needs us to have empathy, understanding, because this very planet is giving us life. And the life is the most sacred thing one can possibly possess. Of all the other things, the greatest possession one can possibly have is one's life. That one's life has to be lived in truth and honesty and integrity and beauty, in rhapsody and rapture. And there is so much out there. Thus, we need to unite, we need to join, and we need to create a better life. And I hope that I'm doing my best, not just with my patients, but also within myself and my students and others who are interact with me. I'm doing my best. I say to everybody, okay, now you told me everything about the negative, and because people always talk first about negative things, about the dark things, about problems. I say, now, okay, done with. Now tell me about other side of the coin. Tell me about other side of the moon. Tell me about beauty. Tell me about rapture. Tell me about flowers. Tell me about the birds. Tell me about the music. Tell me about the art. Tell me about this butterfly you saw the other day. Let's talk about something positive. Let's talk something which is uplifting us, which is nurturing, nourishing us, inspiring, motivating us. Up there, let's talk about it. And not just talk, let's do it. Let's join together and do it.
Yes.
Power of human
That's
connection and
what needs
love.
to be done.
Yeah.
Mm.
Life is a meal, right? It's all the flavors. We're not stuck in any one, just one flavor. Life is all the flavors. With power of human connection and love, it can really restore you. We can all restore you. We all are all powerful, and we are all sacred, and we can all restore you and create that and create a meal together. And that's what every single culture has ever done, is come together and share love and share food and be in circle and fire and togetherness and story. And so I honor your story and I honor your walk. And thank you so much for joining us.
Thank you.
Again,
Thank you.
today.
Thank you
Thank
both.
Thank you.
Have a beautiful afternoon.
you as well.
Yeah. Bye for now.
Bye.